Dr. Ghatan, let's talk about stretch marks and what can a person do for it, against it, maybe to prevent it or to get rid of it once they're there.
Well, to prevent, in some situations may be possible. Stretch marks often come from losing or gaining weight too rapidly. It happens in pregnancy, as you know, and people who who lose weight or gain weight tend to get this very commonly. The treatments available nowadays are not very effective. There are some treatments that are to some extent effective. The best available treatment will be laser treatment. We tell the patient you're going to need a few sessions. We do once a month treatment, maybe about 5 or so treatment, and we expect maybe maximum of 50% improvement. That's for the most part what can be expected. If somebody does better than that, we're very happy for them. Okay. There are creams, there are other treatments available. Most of the time, they're not effective for the most part. If there's a stretch mark that's new, and usually it's pinkish in color, that is more, it's easier for it to be treated. There are some new creams that they claim that they're effective for this kind of new stretch marks, and the laser works better on them also. But once they become old and they turn white and depressed, it's like a depression on the skin, they are a little bit more difficult to treat.
I see. And what about the old fashion exercise with the training, with the laser treatment? Would that help? I mean, does exercise in itself help at all or not really?
I don't believe the exercise is going to go too much for the stretch marks in terms of improving them. I don't believe so. Okay. Stretch mark basically is like a permanent scar, pretty much.
All right. So basically, we shouldn't gain lots of weight in the first place, so that we then don't have to lose it too fast, which is of course not that easy to do for pregnant ladies.
Right.
They have to go through these procedures, type of stuff. So, and your recommendation, what I got out here is, if you got them and have them, for instance, a pregnant lady, she should go and see like a dermatologist who can do laser treatment ASAP. Not next year, not in 2 years, but within, weeks, months.
Yeah, right after pregnancy is over, and yes, it's best to treat early on. The response is going to be much better and much faster, yes.
Okay, well, good. That's very important data to know. Thanks, Dr. Ghatan. Bye-bye.